Good morning. We're doing Become a Skin Specialist Module 13 today, and we're just going to look at, I want to go one back, at some of the information about the machines. I'm going to go through the assessments and give you some tips or things you need to look out for when you answer it, and also discuss some of those questions that most students struggle with answering. And then I'll open up for questions at the end as well. At any time, if you do have a question, you can just type your question into the chat box and I'm happy to answer. Now, when we look at specialized facials, which what this module is about, it first starts off by explaining to you the difference between electrical equipment and electrotherapy. So we do have a lot of electrical equipment in salon. That can be anything that needs electricity to work, like wax pots, magnifying lamps, even your spray tan machine, your steamer, your brushing machine. In facials, your microdermabrasion machine, your ultrasonic machine, your light ray therapy machines. They all need electricity to work, but there's no electricity that goes into the skin. The ultrasonic uses sound waves or ultrasonic waves. Your microcurrent is using your crystals or your diamond head and causing a vacuum and exfoliating the skin, basically. So it's not that there is an electrical current entering the body, but electrotherapy is when you use electricity entering into the body. The client normally becomes part of the circuit, or the electrical circuit goes through them. And in those machines, examples would be your galvanic, your high frequency machine, your microcurrent machine, in body therapy, your faradic machine, but not the others like your microdermabrasion and ultrasonic. And even in body therapy, your G5 is also just electrical equipment. It's not electrotherapy. Now, why is this important? Because when you look at contraindications and if your client has a pacemaker or have epilepsy or have a lot of metal implants, electrical current can't go through their body. They will be contraindicated. But they are not contraindicated for all electrical equipment. They can still have ultrasonic or microdermabrasion or, one of the other machines. So that is why it's important that you understand the difference between electrical equipment and electrotherapy. So electrotherapy is the application of electrical current flow through the human body for therapeutic benefits. And that is the definition. So when we start with assessment 1, a lot of the questions are similar to what you're used to have in your assessments regarding policies and procedures and, your legislation and all of that. And all that information is in your learning. There's just a few things I need to emphasize or so you don't miss it. And when you look at your policies and procedures, because it's electrical equipment, make sure that you explain exactly how you will clean your electrical equipment. So because it's electrical, you can't just wash it with soap and water type of thing. So you will need to use a chemical disinfectant, but you'll do spray and wipe, and you'll do it carefully so that it can't become wet. Think of your electrodes that you use. A lot of them you can detach, and then you can wipe them with alcohol wipe or chemical disinfectant. Some of them, like your microdermabrasion heads, the diamond heads, you can even put in an autoclave after washing them. You can wash them with soap and water and then put them in the autoclave. So you need to be specific on how you're going to clean your electrical equipment in this assessment as well, because it's not just about facials, it's about the electrical equipment as well. How are you going to dispose the crystals that you've used in your microdermabrasion machine? Kate, I know you're on there. Do you have any idea in salon, what do you do with the crystals that have been used? If you can type into your chat box for me. Do you know what they're doing in the salon where you do work placement? Yeah, you've typed in there, you can maybe collect them in a paper towel and dispose of them. Yeah, there's normally an area in the machine like where it collects all the used crystals, and you can unscrew that. It's like a little glass or plastic holder. And I would decant or dispose of it in a lined bin. You can do double bag, especially if you know it's contaminated, if there might be a little bit of blood or anything like that in the crystals. Okay, not a problem, Kate. That was a good guess if you're not even up to that module yet. Thank you for answering that. Now, question 3. It talks about limitations of the beauty therapist in relation to the use of electrical equipment and microdermabrasion treatments. So obviously, as a beauty therapist, you need to be trained in that machine to be able to use it, have the qualification or special training in that machine. But you also, let's say it's Venese massage, high frequency you're doing, the current, it's not just going through you, through the client, it's also going through you. So if you have any of the contraindications, like maybe you're pregnant, then you won't be able to perform that specific treatment. You could do maybe direct high frequency, but you can't do indirect high frequency. So limitations for doing the equipment would also be contraindications, and you can discuss different contraindications. Also your skin types of your client, but then also think about limitations for yourself as the beauty therapist. Question 6, contraindications for the treatments. Like I've said before, a client might be contraindicated to one specific machine. Let's say they have the pacemaker and they might be contraindicated for galvanic and high frequency microcurrent, but they're not contraindicated for microdermabrasion and ultrasonic. So you can still do those machines on them. So in your answer, you'll explain obviously what the contraindication is, and you will say how it will affect your specialized treatments in your specialized facial. So you can give details. I will still be able to do this type of treatments, but not these. Even like, let's say it's eczema and it's dry skin, you would say, well, I won't do galvanic disincrustation because that will just make it worse, but I can do galvanic iontophoresis to infuse a lot of moisture into the skin and help build that protective layer again, so that it helps to prevent eczema. You know, so it will depend on the machine as well. Question 7, you have different skin diseases or disorders that you need to discuss, and it also asks you about genetic factors or causes. So you could say, let's say acne is because of secretion of the sebaceous gland, which is obviously influenced by the hormones, your male hormones, your androgen hormones. And that is what causing this acne, and it starts getting blocked, and you know, you get infection, and you know, you can go on about that. But you also need to remember that it might be hereditary. So it might be in this family they're more acne prone. So if there is some diseases like acne and eczema and dermatitis might be hereditary, so there is genetic influence, there's genetic factors that can cause them having it. So just make sure that's in your answer as well. And limitations would be, again, you know, what you can do for them, what you cannot do for them. It's not to say you can't do any treatments for them. It might just need to be that you need to adjust your treatment, think about the type of machine you would use or the type of products that you would use for them. So be specific. Not recommendations always, you know, some people would always think about medical type of, or I'll refer them to their doctor and they would prescribe their medicine for acne. Fair enough, you can do that, but there's also things that you can do to help them, you know, with the symptoms of acne. So if it's like a grade 1 or 2 acne, you can still do facials, you can still do decleansers, you can still recommend products with AHAs or salicylic acid and stuff like that. So it will just be in this module, you are doing advanced facials. You need to be able to think of all your knowledge that you've already acquired and apply it in your answers. It is a little bit of a step up from just normal facials. So in question 8, there's a specific one that a lot of students struggle with. It says, explain the following ingredients in skincare, why they would be contraindicated for microdermabrasion treatments for 3 days before the treatment. And the ingredients that are listed are AHAs, hydroquinone, salicylic acid, and retinoids. Well, first off, you need to think of what does microdermabrasion do. So microdermabrasion, the information there would be in topic 14.3.7, is going to exfoliate the skin. It's going to remove dead skin. It will help with scarring and pigmentation. But then it also gives you the information that if your client is on any medication that will thin the skin, like Roaccutane, or thin the blood, like aspirin or blood thinners, like warfarin, you have the risk of bruising the client or causing scarring. Okay, because it might lift off too much skin, or because of the suction there's too much blood coming to the skin, and you can have a reaction which we will call an adverse reaction. So to prevent any of those adverse reactions, you need to think of what the client is actually using already, medication they are taking already that can influence the skin. And these ingredients that are listed there, the AHAs and the hydroquinone, salicylic acid and retinoids, are all ingredients that already influence the skin. It either makes the skin more sensitive, makes the skin thinner, it's already removing some of the layers of the skin, the dead skin. So if you're going to do microdermabrasion on top of that, you're going to have, it might remove too much skin and causing peeling or bruising. So you need to make sure that the client has not used these ingredients for 3 days prior coming into their microdermabrasion treatment. So, for instance, in topic 10.6.5, it discusses AHAs and BHA, which is your beta hydroxylic acid, your salicylic acid, and explains how it helps to lift dead skin off the skin and smooth the skin texture. So you can discuss that and say that, and because of that, it will then potentially remove too much of the dead skin, and you might have peeling or bruising or scarring because of it. Hydroquinone blocks melanin formation. It is very chemical. In some countries, like where I'm from, South Africa, hydroquinone has actually been banned in some products because in your darker skin types, it causes vitiligo. Eventually, if they overuse it, so they have a lot of more strict rules there. So it is very chemical. When you put the cream on, it can also burn the skin. It's a normal reaction from using hydroquinone, that you might have a little bit of redness, you might have a little bit of peeling, and therefore it's not a good product to use with microdermabrasion. The same with retinoids. Retinoids are vitamin A. Like Roaccutane, it's vitamin A. Vitamin palmitate is vitamin A. So what does vitamin A do? It shrinks your oil glands, and that's normally why they recommend you using it for acne. But it also peels the skin, lifts dead skin, thins the skin, makes the skin more sensitive. People that use a lot of vitamin A or Roaccutane, you will see the skin is really red, peeling. It can even blister. So you won't be doing microdermabrasion if the client is using vitamin A products. So the amount of retinoids in normal skincare products are normally not that much. So that's why they say just stop using it 3 days prior to having microdermabrasion. But if your client is on a prescribed vitamin A cream that they use every night for acne, or they are using Reaccutane, which is really strong vitamin A, I would not do microdermabrasion at all. I would totally contraindicate it until 6 or 12 months after they've stopped using Reaccutane or that vitamin A topical cream. Okay. So hopefully that gives a little bit of shed a little bit of light on that topic. Now, question 10, it asks you to explain the relationship of the nervous system with wound healing and how this will affect microdermabrasion treatments. In topic 14.3.7, again, you get some information about what, you know, microdermabrasion do to the skin. So normally you have a little bit of erythema, redness on the skin. Some clients might peel, maybe not after the first treatment, but if they come in for a series of treatments and they come like every month or every fortnight, they might have some peeling. And it all, you know, helps with that skin renewal process, because that's why we're doing the microdermabrasion, especially if you're doing it for scarring. But you have to put a lot of moisturizer on the skin. You have to be careful because the client can burn pigmentation, so they have to use a strong SPF. They might be photosensitive. So keeping that in mind, the effect that microdermabrasion, what it can have on the skin, you can imagine that if you do have a wound on the skin that's still healing, like a little scab or abrasion on the skin, that this will prevent it from healing properly. If I go over the microdermabrasion on that area, I might lift the scab that has been forming. So I need to avoid any wounds or abrasions on the skin, because it will, you know, it can also cause some damage and potentially some scarring. So you have to be careful. Okay. And also, while that wound is still healing, the skin receptors, sensitivity receptors, pressure, pain, heat, all of that might not be working as effectively. So you might be hurting the client and they won't know. They won't be able to tell you, oh, this is too strong. So be careful. It should rather heal properly before you start doing microdermabrasion. So there's just a little bit of a spiel of a type of an answer that you can put into that question to help you answer it. But hopefully my explanation also helped a little bit. Okay, when we get to question 13, it is important for you to review topic 14.3.1 and 14.3.2 because it gives you the definitions of what static electricity is and you know, energy, electron movement, direct current where you have a steady flow of current in one direction. Alternating current is when you have you know, it changing direction. So going from positive to negative, as you can see on this picture here as well. And so you will find all the answers if you review those topics there. Then question 15. You need to give information on the electromagnetic spectrum and its effects on the light on the skin. For some of your answers, you'll need to go back to module 10 because we would have just repeated the same information, being it's still facials. So to make sure that the module wasn't too big and cubisome and repeating ourselves to death, we just left it in module 10. So just go back to module 10 and you'll find the information for that answer in there. Okay. Just to recap, galvanic machine uses a direct current, meaning it goes negative to positive or positive to negative, depending on how, you know, whether I'm doing interferesis or disincrustation. I put the machine on positive or I put the machine on negative. So when I'm doing interferesis, I have the machine on positive, and and it will infuse a water-soluble substance into the skin. This needs to be ionized for the electrical current to go through. So I cannot use any product that contains oils, because that will be an insulator that will stop the electrical current when I do galvanic. Okay, so it all need to be water-soluble serums, gels type of products, and it needs to ampules, and it needs to be ionized. Okay. So some of your skincare ranges will tell you, yes, you can use this product with the galvanic machine. Some will have specific products that they have developed to be used with a galvanic machine. Now, antifreezes are normally done for dry and dehydrated skin, because it can infuse moisture back into the skin, water back into the skin. Okay, so it will help with that dryness and dehydration. Disincrustation is when you have the machine on negative and you create like soap on the skin, and it will take off oil, it will remove oil, it creates this chemical process, and it will remove the sebum. It will help to loosen up your blackheads, your comedones, and your for extraction as well. So it's a really good treatment to do just before extraction. Normally you will have a disincrustation type of fluid as well. Again, it needs to be ionized. So if you don't have a specific product for antifreezes or disincrustation, you can make your own. So for antifreezes, I would use water and salt solution. So I would just take warm water, put a teaspoon of salt in it, and make sure the salt dissolves into the water, just tap water, and you would wrap that around the cotton wool that you use around your electrode, and you can, so that there is conduction from the electrode into the skin, and it needs to stay wet for it to work. With disincrustation, your disincrustation fluid that you can make would be water and bicarb soda, and that will help with the saponification of your oils of the skin. Okay. With high frequency uses an alternating current. Okay, that's the type of electrical current that is in the machine. It's an alternating current. Don't get confused with the name of the treatments that you can do with the high frequency machine. So where it says direct method, it does not refer to the current. It's not a direct current, it's a direct method. So I would do high frequency directly on the skin. I'm holding the electrode, so the therapist is holding the electrode and working directly on the skin. The indirect method or indirect high frequency refers to when the client is holding the electrode and I am massaging the skin. So indirectly it's working onto the skin, because the client is holding it in their hand and I am massaging the face on the skin. The current goes through from where it's in the hand to my hands, and she will feel this tingling, warming sensation under my fingers. So I'm working indirectly on the skin. So high frequency, direct and indirect, does not refer to the current, but the method you apply high frequency onto the skin. High frequency is still an alternating current. With your direct method, there's two ways of doing it. I can do gliding, where I do like circular movements with my mushroom head, or I can do sparking, where I hold the electrode a little bit above the skin and it forms like a spark, like a little zap, like a lightning really, from your electrode to the skin, and it dries out the pimple that I am sparking. So this is antibacterial, it's really good, germicidal, killing bacteria, really good for acne type of skin. Whenever there's a gap between your electrode and the skin, sparking will occur. So whether I just hold the electrode above the skin, or I can put a gauze on the skin and do gliding on top of the gauze, that few millimeters gap will cause like a general sparking all over the skin. Okay. When the client is holding the electrode in their hand for indirect method, make sure that their hands are dry, okay, because you don't want any sparks to form in their hand. And then what we call the treatment is Venese massage. Okay, so Venese massage is really good for sluggish skin, dull skin, that needs a little bit of stimulation. So when I do the indirect method, there's no germicidal effect. It's not for acne skin types. It is just heat stimulation, stimulate the blood circulation, and it stimulates the nervous system, but in a good way. It actually relaxes it. So if your client is really stressed, the Venese massage will help to relax them. Okay. How are we going? Can I move on, or am I talking too fast? Sounds like it must be still going fine. Yeah, move on. It's fine. Okay. So assessment 2 is almost like a case study for every machine. So you need to explain from the start to the finish how this machine works, how you would do it in a facial, your steps that you would do, what products you would use, everything regarding this specific machine. So it goes, or this treatment. So it goes through talking, or you need to describe how you would do antiphresis, how you would do disincrustation, how you would do high frequency, microdermabrasion, microcurrent, ultrasonic, every type of treatment you can do. Okay, so things to remember. You need to say what type of current that machine used. That would be direct or alternating. Okay, some of the machines would not have a current, like your microdermabrasion. And then you can just write there, this machine does not use a current. It is like a negative, what do you call, a vacuum that forms, and you slough off the dead skin with the crystals or your diamond head. So you can just explain how that machine works if it does not work with a current. Your ultrasonic, this does not use electrical, doesn't have a type of current, it will use the ultrasound. Okay. Your number D, your sensory effect on the skin is how it will feel for the client. Will they feel a tingling on the skin? Will it feel hot? Will it be painful? Will they feel a vibration? Will they feel pressure? What will they feel on their skin when you do this treatment? Because you need to be able to tell them what it should feel like, so that they can let you know if it's, if they can't feel anything, or if it's too painful, and then you need to turn down your machine. Safety precautions are not contraindications. So safety precautions would be things like ensure that you first make contact with the electrode on the skin before you turn up the machine, or make sure that the skin is wet so that there is, the electricity can conduct into the skin. Things like that, or no water close to your machine type of thing. That is all safety precautions. Make sure you don't touch the metal of the trolley, or make sure the client has removed their jewelry. That is safety precautions. There is a question about contraindications, but just differentiate between the two. So when it asks you to give a basic outline of your facial, you can just give a quick sequence. So I would cleanse, I would then do skin analysis, then I would do my second cleanse, I would then do exfoliation, I might use the steamer. After that, I would do my machine, and you can explain, just say I would do, for instance, galvanic disincrustation, then I would remove the product, the disincrustation fluid, I would do extraction. After extraction, I might do, your mask, or, whatever sequence you will follow in this facial. So just a short outline. You can just do step 1, step 2, step 3. Types of electrodes would be your attachment that's on your machine. So in this picture, we have a glass electrode here, the mushroom head, and that's from the high frequency machine. So some of the machines have like a roller or ball, some have glass. Your microdermabrasion machines have the diamond heads, or your attachments where your crystals come through. So you will just explain what it looks like, okay, and what type of electrodes you get. Products to be used with the machine. So you would, for instance, we talked about the galvanic, where you would use an ionized product, a serum or gel. When you do iontophoresis, it would be acid base. When you do disincrustation, it will be an alkaline based product. With your high frequency, it doesn't matter. It can be a product that are not ionized. It can be oily. So it can be a mask, a cream, or your massage medium that you use with your Venice massage. So you would just explain what type of medium you would use with this machine and why. Adverse effects is, remember, the bad reactions you get from the treatment. So again, it's not contraindications, it's also not safety precautions. Adverse effects might be things like you could possibly burn, so have redness, erythema, blistering, peeling, sensitivity, photosensitivity. Those are all types of adverse effects because of the treatment. Assessment 3 asks you to choose 2 machines to be used for each facial. So in this assessment, you have 3 clients. You have a little bit of a scenario for every client, and that gives you a little bit of background of the skin type and, their life and possible contraindications. And you need to, based on the scenario, choose 2 machines to be incorporated into a specialized facial for them. So you can choose one type of treatment with galvanic and one type of treatment with high frequency, or you can choose to do a combination of microdermabrasion and ultrasonic sonophoresis, or microdermabrasion and microcurrent, or any of those, depending on the client's needs and what they might be contraindicated to. So be careful, read through your scenario very carefully, because there are little hints, like, for instance, if a client is allergic to aspirin, they might be allergic, the skin might be thinner, they might be prone to scarring or bruising. They might be also allergic to salicylic acid because that contains aspirin. So think about those little things. If your client is wearing a hearing aid, would they need to put it off, turn it off? Be specific with the products you would choose in your facial. So it asks you to recommend products to the client, but also to choose products you would use in the facial. So if my client is coming in and I'm going to recommend Olgology products to them, I would also use Olgology products in my facial. Because you would want them to feel some of the products and know how to use it, because you can talk them through it while you're doing the facial, and then you recommend it for home care as well. The same if my client is coming in for Dermalogica facial, I would recommend Dermalogica products. So keep that in mind. And you would recommend specific products, the name of the product. So it would not just be a cleanser. What cleanser in the Dermalogica range? Go and have a look at their products and choose a specific product, and you need to say why. What in that product, the active ingredients, or the effect that that product would have. Why did you choose that product for the client? Okay, how does a client get ready for a facial? So, Kate, let's see if you can think, have you ever gone for a facial? What would the therapist tell you to do to get ready for the treatment? If you can just type into the chat box. Okay, let's see here. Take your hair out, lie on the treatment bed. That's right. So they give you direction of what you need to take off, what you need to put on, how to position yourself on the bed. And this is what we need in that answer as well. So if there's something specific, like I'm doing electrical treatment, so I need you to remove your jewelry, you need to add that in as well. So you will just explain how they need to get themselves ready for the treatment. I've discussed the home care nutritional guidelines. You need to be specific with vitamins and minerals that will benefit their skin type. Okay, so you'll need to do a little bit of research. There are some in the learning content as well, you know, like vitamin B is good for this, or zinc is good for that. So you'll need to recommend at least one vitamin and one mineral specifically for each client. And you need to list 2 online sources that you've used. So this would be for any recommendations you've given them. You can't list the open space topics. You need to list maybe a web page that gives directions of how to care for your skin after a facial, things to do or not to do, or lifestyle advice. Maybe you've told a client you know, to wear sunblock and a hat when, you know, they're out and about, and maybe you can give them a link to Sun Safety, the cancer website. So think of lifestyle advice, product recommendations, vitamin recommendations, any sources you can give your client that will have more information for them. And you need to give, like I said, 2 sources for each client. In your case study with Victoria, your case study 1, remember to include what causes blistering and bruising and how you would prevent excessive discomfort and over-treating of her skin. So you can include that where you talk about any of your product recommendations, lifestyle recommendations, or even just where you describe your facial in the beginning. But somewhere in your answer, you need to give specific information on how you're going to do this treatment without causing bruising or blistering. Okay, and how you would make sure that she's comfortable, because in the scenario she had a friend that had a really bad experience, so she's really stressed about it. So you need to make sure that you can explain to her what you would do to prevent that from happening to her. In case study number 3, Eliana, you have to explain to her the difference between normal and abnormal aging. So the doctor has mentioned to her she's got abnormal aging. She doesn't know what that means. And you need to explain to her what is the difference. So again, that could be in your aftercare advice, that you give her this feedback and give her more information on that. Again, remember to give the advice on vitamins and minerals for each skin type. I can't stress it enough, because most students be like, oh, just tell her to eat healthy, drink lots of water and go, you know, no. It specifically asks for specific vitamins and minerals that would be good for their skin. It has to do with the nutritional element in this module, in this unit of competency. You need to be able to give that to them. Okay, and then when you get to your work placement and machines, I know a lot of the salons don't necessarily have all the machines. So out there's a lot of salons that have microdermabrasion machines. That's normally not an issue. There's also a lot of salons that have ultrasonic, even if it's like a little handheld one, or galvanic, because a lot of your skincare houses have products that needs now to be infused with a galvanic current. It might be in a combination with another type of machine, like a microcurrent machine. It's not necessarily just galvanic on its own. But I know there's not a lot of salons that have high frequency machines, even though it's very exciting to do, and clients normally love it because they think it's like a laser, but it's not. if you struggle to find a salon, why not looking at investing and getting like a little handheld one that you maybe can use at home on yourself anyway afterwards. I just had a quick look on Amazon this morning, and you know, they're not too dear. So if there is one that you just can't find, have a little bit of a browse, maybe on eBay. Little handheld ones are not too expensive, and some of them are combination as well. So like you have maybe microcurrent combined with galvanic, or some of them are galvanic and ultrasonic. So you have combinations as well. Any questions? Okay, so it doesn't look like there's any questions. Okay, thanks, Kate. If you do have any questions about the assessments, just pop them on the forum. There has been other students that have asked questions on the forum underneath the upload download area as well, and you know, we've answered them or give them some guidance or feedback. I will also upload this webinar under assessment 1 of this module, so that it will be a recorded webinar and everybody can have a look at it. And yeah, and good luck with your assessments. Next week we have a webinar for the next module, which is our Vedic module, which will handle or discuss Indian head massage and reflexology. So hope to see you guys there. See ya, bye.